Aloha. Aloha and welcome to Hawaii Care Choices Healthcare Talk Story. I'm Tish Lopez, your moderator this morning. And on all of the talk stories, I want to send a huge mahalo for all of our dedicated participants that join us every month. We do see you. For those of you that are just joining in today, we are so happy you join us and happy Aloha Friday. Let's get started. Today's talk story is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. For those of you joining us on Zoom, the bottom of your screen should look like this. Please click on that chat box and say aloha to everyone here and let us know where you're joining in from. Today's healthcare talk story will be diving in and talking about palliative and hospice care. You may ask us questions throughout the presentation by clicking the Q&A box at any time to submit your your questions to our panelists. To all of those watching on Facebook Live, thank you for joining us and aloha. Please send your comments to say aloha and let us know where you are joining in from, whether it be your car, Starbucks, or in your office. Feel free to chat in questions as well and share your reactions with us during this talk story using your reaction buttons. We absolutely love seeing the hearts and thumbs up, the care button, and we encourage you to share this live video with all of your friends. We are also doing polls today. So for those of you watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you using that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me, lopez@hawaiicarechoices.org, and I will send you the link. Now, polling is very simple. When you hear the brain teaser bell, a question will pop up on your screen, similar to what you see here. Please make the selection you think is best and submit your poll by using the bottom button. Just to kick things off and get you all started, we are going to do our icebreaker. All right, there is that icebreaker and brain teaser bell. And the question up on your screen is, if you could be one of these mythical animals, which one would you be? A dragon, a unicorn, a mermaid, or a sphinx? I myself would like to be a mermaid just because it is coming into summer and it is so hot, and I would love to be at the beach right now. So go ahead, there is no right or wrong answers. Just go ahead and put your best answer in there and click submit. All right, I'm going to end the poll right there and share our results. So 33% of you said dragon, 50% said a unicorn, 0% said mermaids. I'm going to include myself in that one. One person said mermaid, yay. And 17% said sphinx. There we have it. Thank you so much for engaging in our polls with us. Super easy. Everybody's got that coffee flowing or maybe even that tea flowing. So great job. At this time, I'd like to welcome our guest speakers for today. First up, celebrating 6 years at Hawaii Care Choices, she is responsible for educating healthcare providers, medical staff, patients, and families on the many services offered by Hawaii Care Choices, striving to raise the awareness of palliative, hospice, and bereavement care in hopes to provide world-class healthcare choices and solutions for all. Please give a virtual warm welcome to Lani Weigert. Aloha, Lani.
Aloha, Tish. Mahalo for that wonderful introduction, and Aloha Friday to all of my friends right here on the presentation. Thank you so much for joining us. I'm really excited to unpack all the information today.
Wonderful. Also joining us this morning is a woman who has dedicated over 30 years of service, leading, encouraging, and advocating for quality of life and support to all in her community. She is someone who understands how palliative care can be helpful at any stage of illness, but especially effective when provided soon after a person is diagnosed. Today, she shares her vision of how palliative care will be the game changer in healthcare and how these new tools that will proactively identify those who are unaware that they could benefit from this specialized care. Please give a warm virtual welcome to our CEO, Brenda Ho. Aloha and welcome, Brenda.
Oh, aloha, Tish and Lani. I so appreciate this opportunity to be with you folks today. You have done an amazing job of communicating what we're doing out in the community with this product of our talk story. And so to be a guest, I'm just like really thrilled. Thank you.
We are so thrilled to have you as well. Thank you for joining us and taking time out of your busy schedule. This morning, Lani and Brenda will talk story about palliative care and the support you or your loved one may qualify for. They will explain how this care is paid for with little to no out-of-pocket expense to you or your family, and the possibility of transferring to an even higher level of care and support for you and your loved ones. I am so excited for you all to be here today on Healthcare Talk Story. All right, friends, here we go. Please give a virtual round of applause for Lani Weigert as we listen and learn to the reasons why palliative care can help. Aloha again, Lani.
Thank you so much, Tish. Thank you so much. Let's begin right away. So, reasons why palliative care can help, especially if somebody is living with a serious illness. So, what is palliative care? A lot of times people don't even resonate with the word palliative, but to palliate is to soothe, to ease, to relieve. And it's a wonderful specialized type of care that we have brought to East Hawaii. And I'm really excited to explain that this is an extra layer of care. So the routine care that your physician gives you, that's one layer of care, but palliative care is indeed an extra layer of care. And it's quite specialized because it focuses on relief. The goal is to improve the quality of life for both the patient and family, whoever is dealing with that serious illness.
Right, Brenda, we would, our audience would like to ask you if you could please give us an example of the kind of support that they could get from Kupu Palliative Care and maybe a one or two benefits.
In the design of Kupu Care, and our desire was truly to help people navigate this disease process or where they find themselves when they're diagnosed with a serious illness. And it isn't that our healthcare system is not supportive or appropriately attempting to answer those questions. But when you're in the doctor's office and then you go home or they call you on the phone with your results of your test or their diagnosis, it's earth shattering. I mean, it's a very, very emotional, oh my gosh, a realization of how I'm going to live with this disease. Palliative care is really meant to help people navigate the healthcare system, find information, how to what happens after that, a doctor's visit, and the rest of the 23 hours in the day. How do you communicate that with your family and your loved ones? What do you do tomorrow? How did life change? And that is a key thing to what palliative care is looking at. It's that caring, it's that walking beside you through your journey, and helping you navigate that, as well as helping you prevent some of the crises that might come up because of the diagnosis that you've been given, or the disease or the illness, and how to mitigate any crisis that might be coming up, and for your family, what the heck is going on, and helping them understand that. So that's just a few things that we're with palliative care.
Thank you so much for sharing that. That sounds like such great support. Go ahead, back to you, Lani.
So, hi, Brenda, it's Lani. I just wanted to ask you, because Hawaii Care Choices was formerly Hospice of Hilo, meaning the main program that we were offering was hospice, how did the whole idea of expanding to palliative care even occur?
Oh, what a great question, Lani. Thank you for asking that. I've been doing this for a very, very long time, and I really know this community, and I've had the honor and pleasure of being a resident of this community. But I also have tried very hard to promote the amazing work of hospice and the hospice benefit as is defined by Medicare. And it is the, as Lonnie has frequently said, the Cadillac of healthcare. It's available to everyone. And it's so sad that people sometimes don't use it in a timely manner to get the full benefit of it. But I say, if you have any doubt, get hospice, because it is the best. Now, the problem is that when it became a Medicare benefit, there was time frames put on it. And what we see sometimes with the requirements to qualify for hospice care, you have you might not fit into that criteria. And so I've seen that. I saw that. I've seen it many times with my neighbors and my friends and my family, that they were still on chemotherapy. They were still seeking aggressive treatments. They were, their disease process was debilitating, but it probably was not fitting into that 6-month estimated life expectancy if the disease continued its course. So what happens with that? And an example of story, I hope you don't mind if I share. The real challenge happened when one of our volunteers, she was amazing. She gave so much to us and to our mission and our community. And she came down with some stage 4 cancer. And she didn't know it. She had actually was coming to a volunteer training program, and she missed it, which we thought was very, very odd, because she never missed anything. And she called me later and she says, "Oh, I'm coming up, but I have to go to the hospital because I'm really sick. I've been in bed for a couple of days." Anyway, she called me the next day and said they had diagnosed her with stage 4 cancer, and that they gave her 3 months to live if she would do aggressive chemotherapy. Well, she says, "But I want hospice, and I want that whole embracing of what you folks do in hospice, but I also want to have this extra month of life for chemotherapy." And so she went down that path. But thank goodness chemotherapy is not as toxic as it used to be. It's a lot easier now to tolerate. But she was very, very sick, and she was in and out of the hospital. She was in a lot of pain. Her family were just lost with what to do, and how to navigate this new phase of life. And I was so sad because while we helped her, we couldn't admit her officially into the hospice program because she didn't meet the criteria. And so at that point, I was like, gosh, we have to do something. All these people that are seriously ill, they might not even be terminally ill, but they're seriously ill. And this is a hard thing to navigate our healthcare system. So how do we do that? So back in 2012, I said, let's jump on this bandwagon and figure out a program that we can better serve our community. So that's why. And then you ask, how do we change from hospice to Hawaii Care Choices? We are so much more than hospice. We have our active Kupu Care program, which is our palliative care program, and we have concurrent care programs that are based on your health insurance. And we have our amazing bereavement services that we will continue to expand. But we want to we wanted to capture all of those things that we offer. And we also serve the whole east side of the island. And sometimes just calling us Hospice of Hilo, people were under the understanding that is, oh, you have to live in Hilo. And I personally live in Keau. And so I am like, wow, no, Hilo is not the center of what we do. It's all of East Hawaii, which is from Lapahoihoi Point to South Point Road. And so Hawaii Care Choices embraces that we're more than hospice, we're more than just Hilo, and we have choices, guys. It is all about choices and helping people navigate what those choices are. We offer a lot of care that we walk beside people in our program, but there's so you have understand your choices a little bit better. So that's our name change, Hawaii Care Choices. Thank you for asking.
Thank you so much, Brenda. I love how you explained that the additional service of palliative care came from a really deep and meaningful place of love from you because of your connection with this person. And that will continue to resonate across our communities. And thank you so much for creating that. And also that our gift to the community is the choices, that people have choices, that we're not taking away the control of their healthcare away from them. I just love that too. That was just brilliant, Brenda. Thank you. Thank you again. I'm going to just continue on with explaining, in palliative care, oftentimes with the entire gamut of different illnesses, which illnesses are part of our palliative care program. And so to cite a few of them: cancer of any type, congestive heart failure, COPD, and really lung disease overall, as well as kidney disease or kidney failure. So these are very specific health conditions that often require another layer of support. And that's why we have them in this program. Also, a lot of times when you look at these types of health conditions, there is a higher risk of death. And so we want to already surround the patient and family with as much support as possible because of that possible risk. And we really want to boost the quality of life again for the patient and the family by providing support. We often see that when people come in, they have a serious illness, they're at the doctor's office, a real clear indicator that that person could really use the support at home is if the caregiver starts to look frail. And that is one of our number one red flags. If you see that, or if that's occurring in your home or a friend or family's home, do not hesitate to call us. And also, if it starts to become quite a strain on not only the patient's life, but for everybody in the family, this is where you know that we can come in and we can support you.
Thank you so much, Lonnie. Brenda, I just have a comment from a listener that just appreciated the story that you said. She started listening in, and she was going to ask if she can still pursue her active chemotherapy since she has been diagnosed with cancer. And she is happy to hear that she can come on to palliative care. So thank you so much for sharing that story. We're going to oh, there, that brain teaser just went right ahead of me. We're going to do a brain teaser now. The question up on your screen is, how is palliative care and hospice care the same? Both relieve suffering, both delivered in patients' homes, both improves the quality of life for patients and their families, both creates a plan of care, or all of the above. For those of you watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you. Feel free to put your answers right there in the comment box. We invite everyone to join in the fully engaged Zoom presentation next month by emailing me, llopez@hawaiicarechoices.org, and I will send you the link. Again, no right or wrong answers. Just feel free to put in any choice and click the submit button. I'm going to go ahead and end the polling right there and share our results. 100% of you said all of the above. Thank you so much for engaging into our polls. Back to you, Lonnie.
Thank you so much, Tish. Okay, so let's talk about some of the reasons why palliative care would be necessary, why somebody would reach out to us. First of all, if anyone is dealing with any of these serious illnesses that I just mentioned previous, there often is pain involved in that, and it could be chronic pain. And what happens is, if the pain is not addressed, then we start to become depressed, and the quality of life just starts spiraling down. And without education, we will start to become quite anxious about the conditions that we're dealing with. And when we become anxious, we start to call the doctor at all times of the night. We start to go to urgent care. We start to call the ambulance and head out up to the emergency room. We start to cost ourselves quite a lot of money. And so when education comes into this, we are here again to support the patient and the family, and managing the pain and providing education is really the key to lowering everybody's anxiety about having to deal with a serious illness.
So Brenda, I know that, nobody, thank you, Lonnie, for explaining all of that. We know nobody really wants to be in pain. And they're so excited that palliative care can help. But our audience is really asking, do they have to give up their personal provider to join on Kupu Care? Will they have a new doctor that they have to seek out or make appointments for if they are on palliative care?
Perfect question. Thank you so much, Tish. Palliative care, even hospice, is not intended to take away your healthcare system. It's actually, we call it an extra layer of support for not only the primary physician and the family. It really is about helping coordinate, helping with communication. And we have a very fragmented healthcare system, and we're trying really hard to break down those barriers. But there is communication issues. So if you go to the ER, how soon does your primary know that? If you go to your primary, how soon does your specialist know that? If you're in the middle of the night and you're having severe pain, hey, I'm a healthcare worker. I am a nurse. I have connections. And sometimes I sit here and go, oh my gosh, what should I do? Should I call the doctor? Should I go to the ER? I don't know what to do sometimes. I was like, oh no, it can just wait till in the morning. I don't know how many of you guys do that, but and we try to make, we don't want to be a burden, right? As an individual that has a healthcare issue, we don't want to be a burden. We don't want to be, the person that calls the ER every night, right? Hawaii Care Choices really walks beside you. You could call Hawaii Care Choices, either if you're in the palliative care program or you're in the hospice program, or even if you're in the bereavement program. It's just somebody, it's a live voice that you're going to talk to that's going to help you figure out what is the best thing to do. And just having somebody to validate that for you I find it very comfortable, and I'm just assuming that others will too. So the answer is no, don't give up your primary physician. They are so key to us being successful, as is your specialist. Those are all key people. All we're doing is helping you understand maybe what some of those guys are saying, or maybe we're helping you when they're not available, and filling in the pukas to your care and your comfort. Hope that's helpful.
Thank you so much, Brenda. It definitely is helpful. I appreciate you answering that question.
Thank you so much, Brenda. I wanted to ask another question on if the physician doesn't recommend palliative care or possibly hospice, depending on where the patient's symptoms are. How should they go about maybe activating that, especially because they're receiving this kind of education now? What would your suggestion be?
We're all about empowering the individual to drive your own healthcare. If you are waiting for somebody else to help you, you're probably going to wait a long time. So if you feel like you have a need, if you feel like you're just lost and need help, but again, don't know how to reach out, man, the number's 969-1733. Please call. And even if you don't know what's going on, or if you qualify for anything, we'll help you navigate that as well. So call our number, 969-1733. We'll talk to you and kind of help figure out where you're at. You don't have to have immediately a physician's order or direction to come into our program or to access our program. And believe me, we will reach right back out to your physician. So you're not insulting your physician at all by doing that. Because I think that's sometimes like, oh, well, I don't want to overstep my physician or second guess my physician. I don't think they feel that way. Remember, they have a lot of patients, and they want to take care of you, but they might not know that you need additional help at this moment. So call us, and then we'll connect with the physician and close that circle.
Thank you so much, Brenda. I reflect back when my dad was diagnosed with congestive heart failure. His doctor didn't mention anything to us about having palliative care or even possibly getting him additional care in hospice. And so, his only wish to us was really to pass at home when that time came. Sadly, when he couldn't breathe and got rushed off to the emergency room, by the time we got to the hospital, he had already passed. So it was such an epic fail on our part because we really didn't know, and we didn't realize that we had the power to just ask the doctor, which is why I bring it up, because years later, when my mom was diagnosed with lung cancer, her doctor proactively said to us, Mom can have hospice care at home, which she had already elevated past palliative care because she no longer wanted any kind of treatment, which was why we were offered that. And knowing the difference between having this care and not having this care is just day and night. The tremendous regret we had because we didn't know, and the wonderful comfort that we received when my mom finally got hospice care is just day and night. And I just would like to mention to all of the listeners that that doesn't have to be you. You don't have to have regret. You can go ahead and take that power right back and make it your own kuleana and call in today, because I feel so much better now that we were able to do that for my mom. And it was largely because she didn't want to be a burden to all of her kids, which of course she wasn't. But the fact that she had a choice in the end was what was really beautiful about it. Thank you again, Brenda. Thank you so much. Okay, so I'm just going to move right into helping people stay in control with their care. Palliative care helps us do that, helps us provide that opportunity for anyone that is dealing with a serious illness. And the reason is, I really liken palliative care to be the human side of healthcare, because it always reaches right back to the patient and wants to know, tell us, what is your priorities? What are your values? What is it? What's important to you, so we can put that in the plan of care or the goals of care to make sure that that stays right up and center in everything the care team does. And as far as having an advanced healthcare directive, if you don't have one and for some reason you're not on one of our programs, I want to just share that very, very good friends of ours from Community First Hawaii provides an amazing presentation where people actually leave with a completed healthcare directive. And in fact, their next one is going to be on June 14th at 9 a.m. at 1055 Kino'ole, which is the ADRC. So we put that information in there. I'm just saying to you that a lot of times people will put hospice as part of their advanced care directive plan. And we really want you to know that that really helps the family try to figure out, what does mom and dad really want? And you have it right there. So again, putting you in control of your care is our number one reason that we provide choices to everyone.
Thank you so much, Lonnie, for explaining that. I put the link to register online for all of our listeners on Zoom. You can go ahead and visit communityfirsthawaii.org/registration to go ahead and get your seat in on that healthcare directive class. Brenda, I know that Lonnie spoke a few times, and the audience would really like to know briefly what suggestions might happen with the goal of care plan. If you can explain a little bit more what that would be or would look like.
Yeah. Yeah, I'd be happy to. Thanks, Tish. I think what we're seeing is people maybe don't know the scope. I don't know how many of you guys have been told that, oh, there's a 70% chance of rain today. So if you think of a 70, well, especially in Hilo, you think of it's probably going to rain, right? So you're planning and you're setting out and you're designing how that will impact your luau that you're having in a couple of days when there's a 70% chance of rain. But the information. You've reached out and you got information in order to make your decisions on what you're going to do. Sometimes we don't do that in healthcare because we don't maybe think that we can handle what the information is, or maybe we don't think, maybe the provider doesn't think that you can handle what the information is, or what the options are, what might happen. The goals of care is really about getting honest about where you're going and what you're doing. I've hit an age now where I'm having to get honest about what my capacities are and what I decided that I probably can't do CrossFit anymore. And that's okay, but it's hard. But if you start thinking about it and knowing what the situation is that you're facing, and putting and having somebody talk to you about that, we always want to go to the highest level of possibility of that not happening to me, or that won't happen to me, or I'm a strong person and it won't happen to me. But what if it does? What if it does? How do you plan for that? How do you make sure that, okay, so that's where you want to go, but here are the chances of some barriers that are going to come up in that course. How will you navigate those, and how will you make a decision if that happens? So just to give you a full-on example, if you have stage 4 cancer, and a dear family member of mine right now does, not really impacting right now, because in that diagnosis, they removed a large part of the cancer, but there's no cure for the cancer. There is no medical interventions that will extend his life beyond a year. But right now he feels great as can be. And so he wants to live life. He was given some choices. If he wanted to give chemo, we can do chemo. We can always do chemo. We can always do radiation. But listen to what the percentage are, and ask truly what the outcome might be. What will that help me live another month? Will that help me live 2 months, 3 months? Will that help me? How sick will I be with the chemo? Asking all those questions. And the goals of care is all about that. The goals of care is about really looking at what your options are, where this path has gone with most people, and then how to navigate it. If you get to this point, what would you like? If you get to this point, what would you like? And, Lonnie mentioned the Advanced Healthcare Directive. That is an incredible tool for anyone that's 18 or over, because how many people do you know that have had an accident, even young people that have had an accident, and they find themselves, they're not able to make decisions for themselves. And what would have been their wish? Would they have wanted to be unrecognizable as to living in the community? Would they be able to even come 50% up to what their function and thought process was before the incident? We have to think about that. And what would be your desire? And those tools help you write that down. So the goals of care is when you have a diagnosis and we can set up the path, the course, and recognize what the barriers might be, and then where do you want to go from there, as what's your final goal. And the advanced healthcare directives do the same, and those are typically utilized more for unexpected situations that happen, car accidents, things like that, strokes, that people find themselves unable to control their lives anymore. Who do you have as your spokesperson to make sure that you're not on a ventilator or in a vegetative state for a long period of time if you don't want that? If you want that, then go for it. It's about choices. Thanks for asking.
Thanks so much, Brenda. I really believe that the Advanced Healthcare Directive is probably the most loving gift that anyone could give their family, and it's free. And during those times, and I know you're fully aware of those kind of conversations over the bedside, where people are trying to decide what mom wants. And if only we knew what mom really wanted, then we won't be arguing over her bed at the hospital. Is definitely a scene that if we can avoid it, by all means, let's do that. Brenda, I just want to follow up with another question on the goals of care. Does that help with regard to identifying people getting the right care at the right time?
It's all about that, Lonnie. Thank you. I do, so when you have these conversations before things happen, you're clear of thought, and you have the capacity to really analyze and use and talk to others, right? So it's the Advanced Healthcare Directive or the goals of care. It really helps you again navigate what's going to come down the road here. What can you expect? And so I think it's how many of you had not expected, or you have your luau and all of a sudden the weather changes, and you now have a deluge of rain, and you're trying to figure out what to do because you really didn't have enough tarps or whatever, right? So yeah, it's hard to make decisions in the middle of chaos. It's hard to make decisions, and all of us will go to the thing that's the least resistant, and it might put us in the care choice that we didn't want, right? And can I just add the burden of your loved ones having to make a decision. Again, I've been doing this a long time. So a friend calls me and says, my, mom is, she's in her 80s, and she had an event and ended up in the hospital. And everyone knows that her disease processes, because she had more than one. She didn't have a long life expectancy, but she found herself in the hospital, and they were going to, they needed to make a plan. And everyone wants to come up with the easiest thing to make everybody not sad. So she was offered rehab, just to see if they could get her back walking. The problem with that is then the daughter has to hear that, even though she knows that that isn't ever going to work. If she denies that, then she's got the burden that she made a choice that possibly didn't give mom everything, that the quality of end of life that she wanted. And so I think it's really, really important. I just say the burden of that weight of making decisions. And we have videos and we have situations galore where the family has to make a decision if they're going to move through, they're going to listen to that. Oh, if they have 25%, shouldn't I go with it? If they have 50%, shouldn't I go with it? if I know that we've tried this before and I'm the one that says, no, we don't want to put mom through that, do I have to live with the guilt that I made a decision that ended mom's life? No, no, you didn't. The disease process did that. You are not liable or responsible, or I just hope you don't carry that. The same thing when we have lots of technology, you guys, we have lots of medical interventions. And we want to look at those just like we look at our taxes and every other choice we make in life. Is it the beneficial to quality of life and where we're going? And so we want to make sure that we have the right information at the right time so we get the right care at the right time. And having people to talk to about that, not persuade you one way or the other, but to really look at what your options are and what the outcomes might be. It just gives you a platform. So I don't know how many people I've talked to or found that their loved one ended up on a ventilator in the hospital, and there's really no hope for returning to any quality of life and or to the normal person that they were prior to the event. And the family has to make the decision of taking them off or not. And the guilt and the burden of that, they live with the rest of their lives. So let's society, let's fix this. Oh my gosh, let's have those conversations. What is it? And make sure and hold our healthcare system accountable, including us, for telling you the truth and making sure you fully understand what your options are. So I don't know. There's my answer to that. I think I answered it.
Thank you so much, Brenda. Thank you. It really lends into how palliative care and hospice can provide so much caregiver and family support. And oftentimes, because of cultural differences, many times we feel shame to call in and get information because, we were raised you need to just take care of your loved ones and not ask for help. But there couldn't be more from the truth than that. And so palliative care and hospice care definitely comes in and can help the caregiver and family support like no other. And the key is always going to be early admission so that we can help the family cope and manage.
Absolutely. I couldn't agree with you more, Lonnie. Brenda, I know we've been talking about this wonderful support and services, not only for the patients, but for their families as well. And our listeners are really wanting to know, where can they receive this care? Is it somewhere in Hilo? Is it somewhere in Keau? Do they make an appointment? Can you let us know?
Yeah, we have all of our services are primarily to help people in their own homes, in their own communities. So if you're anywhere in the East Hawaii region, you can call us and we will help you. We were blessed, and I just want to say this and put a plug. I don't know if this is on our agenda, but we are blessed to have an hospice inpatient facility. And we built that facility because we wanted to add another resource to help people stay in their own homes and be able to take care of those that maybe didn't have their own home or adequate caregiver system or just needed more support until they were prepared or ready to do that. And or go somewhere if there are symptoms and they needed more serious intense care, they had somewhere to go that was specialized in our hospice. And so we built that inpatient facility because this community supported that for that purpose, just to make sure that we could keep our own family members here and close to home. So we do have an inpatient facility that we take care of individuals, and that might be another topic. But I just want to put that plug in there. But for the most part, the palliative care and hospice is about how to help you in your home and in your normal life. You don't have to go somewhere or necessarily be somewhere to get our care.
Wonderful. That is so great to know. All right, listeners, so you can receive this specialized support and care right in your own home. And there is our brain teaser bell. I am putting up a question right on your screen that asks you if early patient sign up ensures more support and quality of life for all, true or false? And for those of you watching on Facebook Live, you will not be able to engage in the polls, but we still want to hear from you. Feel free to put your answers right there in the comment box. We invite everyone to join us in our fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and we will send you the link. You can also visit us on our Facebook page as we do go live on all of our talk stories. I'm going to go ahead and end the poll right there and share the results. 100% of you said, yes, it is true. Early patient sign up ensures more support and quality of life for all. Thank you so much for engaging in our polls, everyone. And thank you for listening and being here on Talk Story.
We have such a smart group. I just love you guys. That's awesome. So, a lot of times we're talking about palliative and hospice care. So I just want to explain a little bit about palliative care. So palliative care is a very large umbrella, and under that umbrella is a subset called hospice care. And what happens is hospice care is the highest level of care that anyone can get. And so as people continue on their journey, there becomes a time where they transition to the need for a higher level of care. And that normally is hospice care. And I tell you, hospice care has the most robust benefits of all. The difference between palliative care and hospice care is that hospice care has a definite qualification requirement, which is a 6-month life expectancy or guesstimate that the physician normally makes. And oftentimes the physicians are a little squeamish about making that decision. So when we take our responsibility for our healthcare back into our control, we're able to just ask the direct question to our physician. And if the physician says, actually, Mrs. So-and-so, it looks like you could qualify for that. Good, because I want all the goods up front. I mean, why should I or my family be waiting just because my physician might be a little squeamish on making that decision? If you feel like you could qualify, do not hesitate to ask your physician about it, because the smooth transition from palliative care and hospice care is all within your own control. And I'm just letting you know that if we are on your care team, we'll already be watching that for you. But I want you to know, do not hesitate. You are in the driver's seat. If that's something that you feel that it's time, because you don't want any more curative treatments anymore. You want comfort to be your priority. You want to go to the canoe race or your grandson's graduation, and you don't want to feel bad because you just had a bout of chemotherapy the day before. I mean, if you get to a point where no, I just want to go with the natural progression of how things are going, then by all means, do not hesitate to let your physician or even your care team know that it is time to get the Cadillac of services. And know that that isn't just handed out to everyone. People have to qualify for that. And when they do, I tell you, the amount of benefits that come your way is so abundant.
Lani, I have a question for you coming from our audience. I am currently in kupu care and love the nurses that help me. If my disease progresses and I need transition to hospice care, can I stay with the nurses?
So what happens is that the expertise follows within a team. So what happens is that you would actually be assigned to the hospice care team, which their specialty is hospice care. And we would not allow you to have one iota less than that. So you would be put with the expert team of hospice care.
Wonderful. Thank you so much, Lonnie, for answering that question.
So let's move on to how these services get paid for. And there's different understandings with regard to who pays for palliative care and who pays for hospice care. The thing about hospice care, everyone, is that hospice care at home is covered 100% based on the diagnosis that your physician has provided. And that comes along with anything else that you need. Should there still be some medications that need to keep you comfortable, etc. But I think a lot of people can be unclear with how palliative care is paid for as well. Brenda, can you tell us a little bit about how the difference is, and maybe if there's any insurers that are offering palliative care as part of a package?
Sure, thanks, Lonnie. That's a great question to provide for our audience. So palliative care is, this is like one of the national things that's happening, is how to define and how to, everyone across the nation is starting to feel and understand the enormous benefit of having this service called palliative care available to our community. The problem is that it's not been developed as a clear benefit in most healthcare plans. And Medicare and Medicaid is where we want to move that to. So palliative care, and let me just talk about East Hawaii and what we've done with Hawaii Care Choices. Our palliative care program is very similar to your physician or when you go to the doctor's office. So it's not that hospital visit, but when you go to the doctor's office. So I went to my doctor this week, and the first thing that after I signed in, they said, "Oh, your copayment will be $14. Well, I think all of us are used to that copayment. Well, the way that Hawaii Care Choices Palliative Care Kupu Care program gets paid, because this is what the health plans tell us, is that we are able to get reimbursed for our providers, which includes our licensed clinical social worker helping you in a visit. But there is a copayment, just like if you went to your doctor's office. So we have a lot of things on the background a lot of support in the background that helps. But that primary face-to-face visit with one of our providers in Kupu Care, and again, including our LCSW, that is considered like a clinic visit or a visit to your doctor. We're trying to move away from that because that doesn't embrace all of the other needs that you might have. While that's a great benefit, we really want to get it closer to what hospice looks like. And hospice is paid, basically, we're what they call a bundled program. So when you come into the hospice program, we pretty much cover all of the cost of your healthcare needs. You won't, it would be rare if you saw a bill for any healthcare that you needed once you came into hospice, because hospice is either covering that bill or we're paying for it if it's part of what our plan of care, and that's pretty comprehensive. Unlike in palliative care, you're still covering your cost of your medications and all those things outside of your provider visit. We do, and we are very blessed to have one of the health plans right now, and we're working with a couple of others to expand our bundled palliative care program so that we can be more comprehensive in how we help you. You get to see Jason. If you haven't met Jason, he's our nurse leader. He's amazing. And some of our other team when you're in more of that bundled package of palliative care. And the United Healthcare, they have a benefit. So if you have United Healthcare, you would be able to get palliative care in that bundled package, and it's just more enhanced services. And again, we're looking at a couple of insurances for that. And then you don't have the copay as well. And then we do have health plans that have started palliative care, what we call concurrent care programs. So HMSA has a supportive care program that you really are on the verge of qualifying for hospice, but you still want some further treatments, or more that what you're trying to do is aggressively mitigate the disease process. You can be in that current concurrent care model. But that's all comprehensive as well. In those cases, you get all the providers and everything that you were getting originally. You keep all that, and you get the full hospice benefit on top of it. So HMSA supportive care model does that. University Health Alliance has a beautiful plan that's very, some of my family have used that. It's been amazing, where they were able to get both their traditional treatment care and hospice care at the same time. And the VA is actually coming out with that. So if you're a veteran and you're part of the VA program, ask if you think you need that and would benefit from that. So those are three. And if you are under the age of 18 or 21 and you have somebody in your family that you're caring for under the age of 21, you can get both your traditional, what you would call traditional care for your situation, and get hospice on top of that in certain cases. So there's lots of benefits. So basically, go back to the question of how is my palliative care, kupu care paid for? It's paid for just like if you went to the doctor. If one of our providers comes and sees you, there's a fee that we can get reimbursed for, but it's based on that visit, and there is a copay to that. So just to let you know.
Thank you so much, Brenda, for explaining that. I think that's the biggest question that a lot of people ask, right, is about insurances. A lot of us can't understand. There's different jargon that's used, different language that's used, and we really just get kind of caught up in everything. So it was so great that you were able to explain all of that to our listeners. Thank you so much. I like to just let everyone know, thank you so much for hanging on with us at this talk story on June 10th. We want to let you know that you can connect with us. I know Brenda mentioned it, calling us at 969-1733. That number is also in the chat. You can also email us at care@hawaiicarechoices.org. You can also ask your doctor if palliative care or hospice care is right for you. I want to thank Lani and Brenda so much for your explanation of palliative care and how it can help not only support our patients, but their families as well. Brenda, I just like to thank you so much for answering all of the questions that came in from our audience, sharing these personal stories that you have. Was just really, really amazing to hear. Thank you so much to our audience for listening in today and everyone who engaged in the polls with us. I really hope that you have learned something new today. Excuse me. I would just like to take this time to do a brief exit survey. For those of you joining us on a Zoom, there will be a quick survey that will pop up on your screen. Please make the selection you think is best for all 6 questions and then click the submit button below. We want to let you know that it is anonymous and it will not be shared here today. We would just love to get your feedback on presentations that we do. Lani and I really dig deep on every survey that comes, and we try to change things and improve things, and that is all because of your feedback. We really do listen. So I'm going to go ahead and pull that survey up. Unfortunately, those of you on Facebook Live will not be able to take our survey, but we still want to hear from you. Please send our mahalos, the heart button, care button as well. And wanted to let you know that you are invited to next month's Fully Engaged Zoom presentation. Just go ahead and email me at llopez@hawaiicarechoices.org. So thank you so much, Lonnie and Brenda. Again, while they're doing their surveys, I have two questions that we have collected while people had registered for the webinar. And the first one, Brenda, I'd like to ask, where does medical aid in dying fit into the palliative care hospice care spectrum?
Oh, thanks for asking, because I know that just sits heavy on people's hearts. And again, our name of our organization is Hawaii Care Choices, and individuals have choices, and never should you be burdened or shamed or you have choices. Hawaii Care Choices will support whatever you choose. And if you are choosing aid in dying, or in the many names that they have for it, that's your right to do that. As an organization, it's very important, and we debated, and we have many forums on this. How far can we be involved as an organization? So we don't facilitate that process, because we want to support and try to help everyone live this life with as highest quality and pain-free and with comfort as possible. And some people choose the aid in dying medications, and again, that's okay. We will not facilitate as an organization, but we still stand beside you. We're still helping you. We're still helping the family, and especially after someone passes, then your family's still there. You're still there, and you need our support, and we'll be there for you. So I know that that gets into that fine line of what does that mean? It just means that we're still offering Hawaii Care Choice services just like we have always provided. If you choose to get that medication or any alternative thing that we're not part of, that's your choice. And we don't criticize or walk away from you because of that, if that's helpful.
That is definitely helpful. Thank you so much for answering the question. Unfortunately, we have run out of time, but I'd like to thank you both so much. It truly has been a great talk story this Aloha Friday. I'd like to mahalo everyone. Again, if you feel that you have benefited from this presentation, please let your friends and family know that they are welcome to join us on the 10th of every month at 10 a.m. Just RSVP to myself for the Zoom link, or tune in to Facebook Live. Again, that's the 10th of every month at 10 a.m. Mahalo again for joining us. See you next month right here for Healthcare Talk Story. Aloha.
Aloha.
Aloha, everyone.
Bye. Thank you, Tish and Lonnie.